Hey, everybody, and welcome back to season 2 of the Unchoreographed podcast. I'm your host, Dr. Jenna Lower, and I am a physical therapist who specializes in dance medicine and all things hips. Now, if you have been here for a while, thank you so much for coming back. If you are new to the podcast, welcome. I'm so excited to have you. And I just wanted to address really quickly before we dive into today's episode that season 2 of this podcast is going to look a little bit different moving forward. In the past, Unchoreographed was all about dance medicine and speaking to dancers about health and wellness and keeping your body healthy and performance ready. And while I still feel that that is extremely important for you guys to understand, I have been feeling a calling lately that I need to speak a little bit more to people who are struggling with chronic hip issues. My social media and DMs lately has been flooded with people who feel that they've been dismissed, that they haven't been getting help for these chronic hip issues. And being a hip specialist, I really feel like this podcast is better served, or I can better serve you guys with this podcast being about hip health. Dancers, don't worry. I'm still going to be talking to you because you know you have a lot of hip issues. So that's not going away. But this podcast is no longer just for dancers. This is for anybody who is struggling with hip issues. That might be impingement. It might be labral tears. It might be surgery or wondering if you should have surgery, hypermobility, hip dysplasia, and of course, all of that like messy, misdiagnosed stuff that falls in between. So we're going to be covering all of that on this podcast. And I'm so excited to be able to bring this to you guys because I know that this is a topic that is just not covered enough. And if you are anything like the majority of the clients that I see every single day, you're feeling dismissed, you're feeling anxious, you're feeling hopeless, you feel like you've tried everything and there is just no solution. And I'm here to tell you that that is not the case. And that is exactly what this podcast is going to be all about, giving you back your hope. So we are going to have raw, real conversations about everything involving hip health and we'll still dive into some overall wellness things, but hip health being the primary thing that we're going to cover. So thank you guys for being here. I hope that you will follow me along on this journey, even if you are a dancer and had been here before. I promise I'm going to give you even better content than you were getting last season. And I cannot wait to get started. If you guys have any comments, questions about this, always just feel free to comment below. Leave me some notes, send me emails. I'd love to hear from you and figure out what it is that you guys want to learn about. So without further ado, let's dive into episode 1 on the Unchoreographed podcast. Hey guys, what is up? We are back. We are going live. It's been a while since we've gone live, but we're back. So yeah, I've been seeing this trend lately where almost all of the DMs that I'm getting on social media and the clients that are coming in, they're kind of all saying the same thing, and that it's that I've already done physical therapy, but I'm still having all this pain. Maybe you've already had surgery and it didn't work, or it temporarily solved the problem, but there's still, you're not back to 100%. You still can't stand for long periods of time or walk or run or kind of do the higher level things that you want to do. Maybe you've already completed all of your physical therapy, but you're still having problems. And I just want to address this because I think the misconception is that if you've tried all of those things, that there's nothing else that can be done for you. And the reality is that's not true. I think more often than not, what really is the problem is that the therapy that you had or the things that you've tried just haven't been the right pathway for your body. And that's not to say that your physical therapist wasn't any good. That's not what I'm saying. But the traditional medical system is not set up to help people like you. It is set up to help people who have acute pain or subacute pain. So an injury happens, you go to physical therapy, their job is to get you out of pain. The problem with that is pain is only one piece of the puzzle. What I always tell my clients is that pain isn't the finish line, it's actually the starting line. So we want to get you out of pain as quickly as possible. But if you stop there and you haven't worked on the parts and the pieces that got you into pain in the first place, you're going to keep having problems. And this is where we have to focus in, and we have to really figure out the root of what is causing your issues, whether it be a labral tear, impingement, dysplasia, hypermobility. Like, we have all these different sort of chronic hip issues that often traditional physical therapy just fails. And again, not to the fault of the physical therapist, but just the way that we are trained as therapists is to get people out of pain. And then we sort of aren't great at all the stuff that comes after that. And so what I wanted to make sure that you guys understand is that just because that might be the standard that you have experienced in PT, it isn't the only way. And there are people out there who are specialized in this, myself included, who actually can dive into this in a way that you're not going to get in that traditional healthcare setting. And I think those are the people that really thrive when they come to see me. I tend to get a lot of the people that have failed, and they thrive once they get to me. And it's just because we come at it from a completely different approach. So what does that approach look like? What is so different about it? Well, for starters, it isn't just about pain relief, right? Yes, there are certainly things that have to be done to get you out of pain. In that first stage, like the first stage of the framework that I use is still calming pain. But the goal is to try to get you out of pain as quickly as possible. So 4 to 6 weeks is a pretty good time frame to expect that we can start to see a pretty significant decrease in your pain. But after that point, we really have to make sure that we're working on what are those underlying movement patterns, muscle imbalances. How are you doing certain exercises and movements that likely got you into the situation that you're in right now? I think too often PTs jump ahead to, you got to get stronger. And they start loading you up with strength exercises, and we got to strengthen your glutes, and we're going to do bridges, and we're do all this like strength, glute strength. That is true. However, if you haven't laid the better foundation first, then none of that strength matters. So after we get you out of pain, or sort of simultaneously, right? Like, there's some overlap between all of these things. But as we start to get you out of pain, we really have to look at, how are you moving? Because we have to go after those movement patterns. And there are some really common patterns that people with impingement and labral tears and hypermobility and all of these things, there's some commonalities between how people move and the types of patterns that they tend to move with. And so we have to teach you how to come outside of those dysfunctional patterns and strengthen the effective patterns. Because if we just start layering in strength on top of a dysfunction pattern, you're just reinforcing the dysfunction. So first, we have to make sure you understand, how do you move to put less stress and compression on that joint? Then we layer strength on top of that. That foundation is really, really important. And yes, we still will always come back to those sort of quote unquote quick fixes of, how do I get myself out of pain if I do have a flare up? Because that still is important, but it's just not the only piece that matters. Movement, how you move, and then how you strengthen with those good patterns is really kind of the pathway that we want to follow. And that is where you will start to see changes happen that last, changes that actually stick and feel more permanent and actually feel like they are moving the needle somewhere, versus this constant, I'm in pain, I go back to movement or exercise or whatever it was. It sets me off into pain, so I rest. And then my pain comes down, I go back to movement, it sets me off into pain again, and then I rest. And that loop that people get stuck in, it's so common, but it isn't normal. We don't want you to be stuck in that loop. And so to really come outside of that loop, what you need is an effective strategy to follow that goes far beyond pain relief in itself. So that's kind of the framework that I follow with all of my clients. If you don't feel like you are getting that with your physical therapist, then I would urge you to reassess who you are seeing. Again, doesn't mean that they're a bad physical therapist, but maybe they aren't the right fit for the problems that you're having. If you aren't seeing changes with what's happening in your body in 4 to 6 weeks. Now, that doesn't mean it has to be completely resolved in 4 to 6 weeks. That's not going to happen. But if you're not seeing that trend move in the direction where it's actually starting to improve with a consistent program for 4 to 6 weeks, then something needs to be changed and adjusted. Again, if you're working with a therapist who is really in tune with what's happening in your body and impingement and hip issues, they should be able to adjust that program real time over the course of those initial 4 to 6 weeks to make sure that you're making changes. If they are not doing that, that's when I would tell you to reassess and maybe find somebody who specializes in this. They just might be a better fit for where you are in your journey right now. So don't get discouraged if you feel like you're trying all the things, nothing is working. It probably just means that you haven't found the right strategy yet, and you're kind of bouncing all over the place instead of following a nice, clear path that's laid forward. That goes the same. Maybe you're not in physical therapy, but maybe you're just chasing quick fixes on your own. Foam rolling, icing, taking medication, all of these types of things. It's kind of the same, right? You're solving the immediate acute pain potentially. And you're kind of going after the symptoms, but you're not going after the root. And so then when you go back to try to strengthen, if you're like my patients, you get really frustrated because the pain comes back and you just keep pushing through and say, screw it, I want to get stronger. I'm just going to fight through this. And it actually just makes things worse. And then you have to do more foam rolling and more stretching and all of that. And it's just this endless cycle. It doesn't mean that strength isn't important. It just means you haven't laid the foundation appropriately yet. So that's what I would urge you to really make sure that you're doing. Reevaluate whether it's a plan that you're following on your own, a plan that you're following with your physical therapist. Evaluate what that plan is. Make sure that you're seeing progress within a 4 to 6 week time frame. And if you're not, then we probably need to go back to the drawing board and figure out what would be a better plan for your body. If you guys ever have questions on this, I am more than happy to jump on a discovery call with you and talk through your specific situation and what that strategy might look like for you and your body. Again, coming from somebody who stares at hips all day long, so a bit more specialized in this. I'm always happy to jump on those discovery calls with you guys because I think this is a population that's just really underserved, and I want to make sure that you know that there is still hope out there and there's help for you, even if you feel like you've tried everything already. There is still something, I guarantee, something that can be done to help you learn a little bit more about your body and really start to see progress happening. So with that being said, if you guys have any questions about any of this, if you have things that you want to hear on future episodes, then leave a comment below. Again, I'm going to be back to doing this a lot more regularly now, so I'd love to hear things that you guys want to hear about and learn about. Just drop them in the comments and let's connect. I love connecting with you guys. I hope you have a fabulous day, and I will see you back here again really soon.